Welcome back, everybody. Kentucky One Health Diabetes and Nutrition is a program that offers education to those with diabetes to help them better manage their disease. Its prevention program is for those who are at risk for diabetes and want to prevent it. Claudia Burnett is a diabetes educator and dietitian with Kentucky One Health Diabetes and Nutrition Care. Thanks so very much for stopping by.
Thank you for having us.
It's a big problem, isn't it, these days? And a lot of it is genetic predisposition for diabetes, but a lot of it can be environmental and also what we put in our bodies, right?
Lifestyle, yes.
Yes.
How we eat, exercise, yes.
So what can we do to sort of head it off, especially if we think that there's a predisposition for it? And then even how can we just prevent it just in general so that we don't have to have a life of dealing with balancing sugars and things like that?
We actually do a diabetes prevention program. It's a part of the CDC.
Mm-hmm.
They've done research and have developed this program, and it's also through the American Diabetes Association of Educators. And it's promoting diet, weight loss, exercise. Even losing 5 to 7% of your weight can help possibly prevent diabetes. Increasing your activity, exercise anything beyond your normal daily activities up to 150 minutes a week those are things that can help somebody prevent diabetes if they're at risk.
And sometimes it's even just knowing certain foods, certain triggers that will kind of, I guess, boost the insulin in our bodies, and if we take those out, sometimes we can even, create an environment where we can sort of diminish, if not get rid of, the disease agent altogether, right?
Weight loss, eating healthier, making healthier carbohydrate choices,
right.
Lower fat, healthier choices as far as not a lot of sugar, sweets.
But now we know that these are the things we need to do, but sometimes we need a person kind of doing it. So do you kind of help people to map out a weekly diet plan or menu plan? Or
what our diabetes prevention program entails is, like I said, it's a year-long program. People meet once a week for 16 weeks. It's about an hour each session, and we part of it is increasing activity. A part of it is food. We have them keep food diaries, writing down what they're eating.
Because sometimes if you see it on paper, then it's kind of like, I ate that. Oh.
Yes, definitely. And our program is made up of diabetes educators, nurses, and dietitians.
Right.
Our program involves Kentucky One facilities in Lexington and Louisville, Mount Sterling, Berea, London, Nicholasville.
So there's one that's near.
Yes.
Is this something that's covered by insurance?
Currently, the diabetes prevention program we are under a grant.
Okay.
And so there is no charge at this time for the diabetes prevention program.
Gotcha.
Now, somebody who actually does have diabetes, then most insurance companies will cover.
Good.
Some people do have a copay or a deductible that they may have to pay some out of pocket.
Right. But still the long-term benefits outweigh.
Absolutely.
Indeed.
We want to prevent those complications from happening.
Indeed, especially in our children and seniors. Well, the Diabetes Expo is Saturday, March 19th from 9 until 1. Registration starts at 8:30 at Keeneland Health Education Center. That's 1451 Harrodsburg Road, Building D on the 4th floor. If you're interested in attending, be sure to register online, KentuckyOneHealth.org/Diabetes Expo. The event again is free. And if you need more information, please give Claudia a call at 859-967-5653. Thanks very much for stopping by.
Thank you.
All right, stick around. LAX 18 News at 12:30 continues after the break.